So you're going to bring it here, straight up, okay? Rotate, so here, rotate. And I have the patient actually hang on to the side of the, yeah. So and then just try to relax for me as best you can. There you go. So here, rotate. Okay, you actually will get some audibles out of this as well. Okay, so it's here, rotate, traction a little bit, and full extension. So here, here, pretty basic. It's more of a joint mobilization as opposed to an HVLA. Okay. So again, remember the hip. So again, checking him as well. Mostly internal rotation. He's pretty good. Not too shabby. Okay?
For an old guy. For
an old guy. So number 2, one of the few muscle tests that I do. Now, if you get Dr. Charette's tapes, he has a lot of muscle testing. And I'm cool with that. If you have a way to delineate and get more specific with what you're looking for, I think that's wonderful. One of the muscle tests that I do like to do is for a posterior tibia. I have patients who just come in. I have a gal that I've not seen in like 5 years. She's a rancher. I've not seen her in forever, and we caught up and this and that, and I was like, what brings you in? And she's like, I need my knee done, and it's the only maneuver that I do. She has a time, she's like, it's been great for 5 years, and we check her for a posterior tibia. I said it, and she walks out, and it happened just 2 weeks ago. So that, basically, I believe this is checking for the popliteus, but doctor, you could go in and resist, okay, and you're checking for, obviously, a nice hard. Yeah, there's a difference there. Yeah. You feel a difference? Mm-hmm. All right, so let's try it on him. And resist again. So I can kind of break him pretty easy. Okay. So that, from what I've been taught, is indicative of a posterior tibia. So a couple different ways I've seen done. I never like this one because it gets bulky in the back, pinches a little bit. Okay. So a cleaner way to do that is to come on both sides of the tibia here. See how much flexion he can do. It's actually pretty good. Okay. And what I'm going to do is I'm going to scoop this way as opposed to taking him into hyperflexion. Make sense?
Yep.
So I'm going to scoop this way, and then we'll check you again, okay? So this is a pretty effective adjustment, actually, for people who truly have a posterior tibia. This would be your ingenium recurvatum. You're standing with your knees out like this, or hyperextension. Popliteus is real important with this as well, and we'll show that one next. All right, so again, to see what his range of motion is. Okay. Easy. Oh, here we go. Okay, feel it? Okay. Okay. Now, resist. Okay, resist. Okay, walk around a little bit. See if that feels any different. So that's